Bueno, pues seguimos con este primer eje temático y ahora abordaremos otro tema. El tema es enfoque danés de la salud mental. Y para esto tenemos como invitada a la doctora Katrine Bjørkholt Sørensen, quien es consejera en salud del Ministerio de Asuntos Exteriores de Dinamarca. Ella actualmente está como coordinadora del proyecto de cooperación estratégica sectorial en salud entre México y Dinamarca. Bienvenida, doctora.
Thank you. I am just trying to get my slides up. 2 seconds. First of all, thank you for having me here today to talk about the Danish approach to mental health. Thank you to IMS for inviting the Danish Embassy in Mexico. I'm here on behalf of the Danish Embassy to talk about mental health. And I understand there's simultaneously translation, so you can pick Spanish if you need to hear it in Spanish. Unfortunately, my Spanish isn't good enough yet, so I will be doing it in English. Perfect. So as was said in the introduction, I am the Counselor for Health at the Danish Embassy in Mexico. Mexico and Denmark works on a bilateral healthcare project. One of the main focus area in this project is mental health. So I'm very glad for the opportunity to talk about mental health today because it's a very important topic for us. We do a lot of different activities in our bilateral healthcare project. One of the most recent one is the one you see on the slide, which was our digital workshop between the Danish Medical Agency and COFEPRIS in Mexico. Unfortunately, due to COVID-19, a lot of our activities, all of them, have become digital. So you see it was a digital workshop you see a screenshot from. Firstly, I wanted to say a few words about the organization of mental health care in Denmark. Denmark is a small country in the northern part of Europe. We're a part of Scandinavia, and our healthcare is also called the Scandinavian healthcare model. Denmark has a national level for healthcare with the Minister of Health, like you have here in Mexico, and a national health authority and other national agencies, somewhat comparable to COFEPRIS and INSABI here in Mexico. And this is actually where I used to work before I came to Mexico for the Ministry of Health. Secondly, Denmark has 5 regional levels, 5 regions. They're each responsible for all general practitioners and special doctors and hospitals within their region. And this is where I actually used to work before I came to work for the state in Denmark. So I've worked on both of these levels. But last but not least, we also have 98 municipalities in Denmark, which is our last level of healthcare in Denmark, because each municipality is responsible for local social work in healthcare, such as the capital region of Denmark. In Denmark, we have universal healthcare, which we're quite known for. That means that all healthcare that you receive, either from the national level, from any of the parts in the region, a hospital or general practitioners, or from your municipality, is free for the patient, for the citizen. On each of these 3 levels, we also have mental health care. On a national level, the Ministry of Health and the National Health Authority sets guidelines for what we do in the psychiatric sector in Denmark and what we invest in the psychiatric sector. On each of the region level, there's also a mental health service. We actually split in each region the work we do in somatic healthcare and mental health care. So for example, for the capital region, we have the capital region of Denmark that works with all somatic hospitals and doctors. And we also have the mental health services of the capital region of Denmark. And each region was actually split into these 2 parts to ensure that we had sufficient focus on mental health services in each region. So they have a completely separate entity. On the municipality level, we have local psychiatric care. That is care you need, for example, if you get discharged from the hospital, which the regions are responsible for, and you need a mental health living facility, or you need help with education or finding a job as a mental health patient. So we also have local social psychiatric care. That is a very brief introduction to the structure and organization of healthcare in Denmark. In recent years, the psychiatric sector in Denmark has received a lot of resources, a lot of funding, and has undergone significant investment and development. We have done so in Denmark because we saw a need to invest and strengthen the psychiatric sector. A lot of countries around the world have seen that need, and in Denmark, we definitely put some money and resources into the area. One of the key areas that Denmark recently have focused a lot on in the last couple of years is creating more outpatient treatments. Sorry, I'll just take a sip of water. Is creating more outpatient treatments and less hospitalizations. This is both cheaper for the state, but it also creates a better life quality for the mental health patients. Another area that we have focused on is mental health patients' rights. We have in Denmark a rule that you need a diagnosis and treatment within 30 days. This used to only apply for somatic patients. In 2015, this was expanded to also include mental health patients. This subsequently resulted in a great reduction in waiting times for treatment for mental health patients. So it was a very beneficial initiative. Another focus we've had in Denmark that I think a lot of countries also have a focus on is more prevention and focus on children, youth, and young adults. This is also going to be one of the big themes in Denmark's new comprehensive 10-year plans. We are making it this year in the state of Denmark, and it's going to set the long-term direction for mental health treatment in Denmark. Some of the key focus areas in this 10-year plan is, as I mentioned, youth and young people. It's going to be prevention and quality of care. It's going to be a focus on cohesiveness across sectors. There is some issues with mental health patients being in one sector, the region, under a hospital, being discharged, and then receiving the right kind of treatment and the right flow from being discharged to going to the municipality. So we really want to create a better cohesiveness for the patient and the patient journey between sectors. Some of the concrete hardcore goals that's going to be in this 10-year plan that's going to be published very soon from Denmark is reduction of readmissions for mental health patients. It's reducing waiting times. Even though there are patient rights, there are still some issues with long patient waiting times for patients for some treatment within the mental health care. And it's going to be set up goals for better collaboration between sectors. So this will be published very soon and will be very interesting. Some of the key investment Denmark has made recently in mental health is earmarked money for the psychiatric sector and mental health projects, such as, and this is translated roughly to English, but rate funds, which is yearly special fundings for social and healthcare projects. Denmark has also allocated funds specifically in our national budget, our National Finance Act as a Danish state. Lastly, we financed 1.8 million Mexican pesos in 2020, specifically earmarked for the psychiatric sector. We also are working in the last year of the last 10-year psychiatric plan called the National Action Plan for the Psychiatric Sector. And this also included an influx of funds, roughly 6.3 million pesos, which is given out to the psychiatric sector between 2019 and 2022. So this was a brief introduction to some of the investments and some of the initiatives Denmark has initiated to create a better mental health care sector in Denmark. I would also like to briefly talk about some of the interesting projects that Denmark has, with great success, implemented in mental health to improve the lives of mental health patients. Firstly, we've had a focus on, and still do, reducing stigma and taboos around mental health. Several famous people in Denmark has gone out and explained their own story of mental health issues or their family's mental health issues, such as actors, influencers, podcasts, politicians, most recently the mayor of Copenhagen, to start a conversation about mental health issues. Some interesting campaigns that has run is, first of all, Say It Out Loud, also translated from Danish. It's a campaign that included workshops and collaborations with youth in high school to make them more aware of mental health issues at a young age. We've also had a Twitter campaign, Break the Taboo, which focused on creating a talk and a discussion about mental health on social media platforms, which is why it was created as a hashtag, Break the Taboo. Thirdly, an interesting project that we have in Denmark is the campaign One of Us. It's a national awareness campaign focusing on the taboos around mental health. You see a photo of it on the slide with Her Royal Highness Crown Princess Mary, who visited the volunteers and the workers of the campaign One of Us. They are all wearing the t-shirts One of Us, just in Danish, on the photo. One of the t-shirts in the middle says that nobody is just their diagnosis, which is an essential part of this campaign to make people aware that mental health patients are a whole person and they are equal part of society. So there's been a lot of different initiatives within this theme of reducing stigma and discrimination. Another interesting area I would like to bring your attention to is that Denmark has focused very heavily on creating more modern psychiatric hospitals and facilities, and using the term or the concept healing architecture in creating new psychiatric facilities. Healing architecture is a concept where you try to include light, nature, sound, art, and let's see if there was any other, and colors when you build healthcare facilities. So the state and the regions has made it a great focus area for architecture companies that are building nursing homes, psychiatric centers, psychiatric hospitals, and other healthcare facilities to focus on including this. A special focus for mental health patients have been to create calming nature, calming environments, and calming sounds so that they can have a positive experience when they are either visiting or being admitted to a mental health care facility in Denmark. Additionally, for mental health facilities, there is a strong focus on suicide prevention, which is included in some of the photos on the slide here, and to create safe environments for the staff that works at the mental health care facilities. Speaking of suicide and suicide prevention, a very known and very successful initiative in Denmark is something called the Lifeline. I have written the Danish name in parentheses, but we'll stick to English or Spanish. Lifeline is a volunteer organization that is both publicly and privately funded. It consists of 200 volunteers that offers phone counseling or online counseling, as you see on the slide here, for people who want to commit suicide. It was created in 1994, and because it's so well run and well known in Denmark, the government decided to let it receive funding from the national budget, the National Finance Act in Denmark in 2005. In Denmark, it's generally considered a very successful initiative because it has big public awareness, it has a big reach, and it has done a great amount of work for suicide prevention in Denmark, a topic that has been a great challenge for Denmark to reduce suicides, which has been quite high, the numbers for Denmark. So I did say in the beginning that all healthcare in Denmark is free, but there are some exceptions. Cosmetic surgery, of course, naturally, is not free. Dental work is not free. And consultations with private psychologists is not free in Denmark. For all of these areas, it is possible to get some funding from the state, some help. And if you really need it, if you have a big dental operation, you can get help from municipality if you don't have the finances for it in Denmark. But for the area of private psychologists, the Danish state did decide to initiate a project called the Psychologist Agreement, where they fund 60% of the fees for a private psychologist. This was created in 1992 and has changed a lot over the years. One of the expansions of this agreement is that from people who are 18 to 24, it is completely free to go to psychologists. The government will fund the full fee. This agreement is applicable if you have some of the issues that is on the list that you see on the slide, such as if you're the victim of rape, of incest, if you try to commit suicide, or if you have depression or anxiety. Then you can get 60% of your fee funded when you go to a private psychologist. There has over the year been a very high increase in the people that use this agreement and this discount, especially since they included depression on the list. At the same time, evaluations show that the patients and the psychologist find it extremely relevant to have this agreement, and the government is therefore still funding it. One of the benefits of the program that the government sees is that if you, for example, set in with help at a young age with somebody with depression or anxiety, it can have a preventive effect on their mental health throughout life. So there is a very positive cost-benefit case for the government in subsidizing part of the fee for a psychologist. And they are always discussing if there should be more on the list, less if it should be changed for ages or anything. But this is roughly the list they're working with now. So as mentioned earlier, general practitioners are a part of the region. They are private contractors in Denmark that the region make a contract with to offer free services for each citizen within the region. That means the state pays the region the funding to run as a region, and the region pays the general practitioners for all the services they provide to their patients. Every 4 years, they meet and they agree on a price list and what should be on it. One of the new things that got added is the possibility of the doctors offering conversation therapy to their patients. Of course, patients can still go to a psychologist or a mental health care facility and get free treatment, or for a psychologist funded some of the treatment. The benefits of conversation therapy is that it's free, it's easy, you know the doctor, you know your own general practitioner or family doctor, and there's no waiting list. It is generally targeted for patients who have mild to moderate anxiety, stress, or depression. The doctors can also do something more specifically called crisis conversations, crisis help. This is for patients in an acute crisis, for example, from a stress, a life crisis like divorce, death, unemployment, family members being sick, or other newly occurring mental health issues. A new, quite comprehensive study looked into the effect of these offerings from the general practitioners, and it showed that conversation therapy can greatly reduce the risk of suicide and mental illness after people experience a life crisis, such as a partner or a family member dying. So this was some of the projects that we have in Denmark. I have picked out some today that has had a good effect and that we've seen good results with in Denmark. We are on a journey continuously in Denmark to improve mental health. The exciting new thing for us will be the new psychiatric plan that sets the long-term goal for the psychiatric center in Denmark. We still have areas that we want to focus on and we want to improve. And we still have initiatives that we want to continue funding and grow and build. So I'm very excited to see what will happen with the new 10-year plan for the psychiatric sector in Denmark, which will come out very soon. But I wanted to say thank you for your time here today. Thank you for inviting me and giving me the chance to talk a bit about mental health in Denmark. If you have any questions or you want additional information, or if you want to see the new psychiatric plan we have in Denmark and our next 10-year plan, please feel free to contact me on my email here on the screen. Thank you for your time.
Gracias, doctora. Y bueno, me gustaría poder compartir con usted las dos primeras preguntas que nos hicieron llegar, independiente a que también le compartiremos más tarde todas las preguntas que nos están enviando por las redes y por correo electrónico. Una de las preguntas es, ¿qué intervenciones realiza el programa danés en el ámbito social?
For social environment, I think you're thinking about the local help and the municipality help. So I will answer within that space. A big focus has been on having competent and rightfully trained staff at each municipality that can help mental health patients getting a job, getting a house, and getting a life together. So there has been a big focus in local and social work with training maybe social workers or other administrative people to handling mental health patients. It is an area that we struggle with when people get discharged and living with mental health. But one of the skills that we're trying to build up is having the right staff at local level. I hope it answered the question. Otherwise, let me know if I should answer something else.
Gracias de nuevo. Aprovecho el tiempo para hacerle otra pregunta. Nos mencionan aquí alguien que quisiera saber si la tasa de suicidios o de patologías mentales cambió después de este programa de subsidio del gobierno.
Yes, this is quite an interesting area, or a shameful one for Denmark. Suicides have been very high in Denmark. We have had some of the highest of the OECD countries, which is also why the government funds not just only the Lifeline or the Psychologist Agreement, but have funded many initiatives, and we have gotten it down. We generally do see a high mortality for mental health issues in Denmark compared to the rest of Europe, which is why we need to focus on mental health in Denmark. But for suicides, we have gotten the mortality way down in Denmark, it was very high, but we've gotten it way down. We've invested a lot in the area. When you see as a country you're performing the worst, you need to act on it. So it has been the Lifelines, it has been the Psychologist Agreement, it has been also ensuring at some point we've had a year waiting list for help. So it's free help, but help for people who try to commit suicide, which is also going to be a big focus for Denmark, getting rightfully the help you need after trying to commit suicide.
Gracias. No queremos dejarla ir. Aprovecharemos para hacerle otras preguntas. Durante el periodo de la pandemia, ¿implementaron alguna estrategia para no suspender los servicios de salud mental o cómo fue que lo manejaron?
That is a very interesting question. Denmark has, like the rest of the world, seen a great increase in mental health issues during COVID-19. I think one very big insurance company said there's been a 20-30% increase in inquiries to the insurance companies for help with depression and anxiety. It has definitely not been good for Denmark either. We have tried to make the best of the situation, and we have focused very much on telemedicine, telepsychiatry. So there is a small research group that I know in Copenhagen that was very excited about the pandemic because they work with telemedicine and they got a lot of funding suddenly and everybody wanted their projects. So we have worked a lot with digital solutions. I know a lot of people myself, a lot of people in healthcare who's gotten help, like from the Psychologist Agreement, digitally during COVID. So that has been a big focus, trying to be more digital because we are quite a digital country. So we're trying to use the strengths that we have in healthcare. And I can just add that I think yesterday our new Finance Act was published, and we are funding, let's see if I can translate, but 1 million Mexican pesos to the healthcare, and it's also supposed to go to mental health to support mental health during COVID-19 and somatic health with part of our healthcare.
Bien, una más por favor. Nos preguntan aquí ¿qué porcentaje de la población de Dinamarca utiliza estos servicios para salud mental?
So I have a few different statistics I can elaborate on today. Generally in Denmark, 12% of the population is receiving medication for a mental issue, and 10% of the population is experiencing a mental health issue. So that would mean that 10% of the population will be going through our mental health care facilities, but a lot of them are out and about and not hospitalized. So we don't have that high of an admittance rate and people in a psychiatric hospital.
Doctora, nos sentimos muy agradecidos y muy honrados con su participación. ¿Puedo hacerle una última pregunta antes de que termine su participación? En este caso, también nos preguntan cuál es el papel de la tecnología y de los smartphones hoy en día en cuanto a este abordaje de la salud mental. A veces pueden ser un papel positivo en cuanto al apoyo y a veces pueden ser algo negativo sobre el uso excesivo.
Yeah, that's an interesting conundrum for public health. Denmark, as I said, is highly digital. I think the UN declared Denmark the most digital country in Europe. We have pretty much all our services digital. So that is a great resource. I used to work in IT. I used to work with digitalization. That's why I'm a big fan of all electronic patient records, telemedicine. We have interesting app projects. We have an app that can register the tone of voice for a mental health patient when they call in their doctor. And if they're manic depressive, say if they're depressive or manic. So we have interesting mHealth, interesting digital solutions. But we are also a country that is very much on Facebook, on social media, using the screen. A lot of the workers in Denmark work on a computer, which is also a bit detrimental to our public health. So I think we see digitalization as an opportunity, but definitely also something that causes mental health. And I think that's an issue for many European countries. But we try to get the best out of digitalization, which is also why something like social media has shown to the amount of time you're on have shown to increase depression and anxiety, which is also why we're trying to get campaigns, and then especially the National Health Authority is trying to be more young and be on social media and hire influencers and use them. So we also trying to get positive messages out through social media, even though it can be a creator of a mental health issue. So we're trying to balance and getting the best out of the situation.
Doctora, muchísimas gracias por su participación. Gracias por responder nuestras preguntas. Como le comentaba, no serán todas las preguntas, le haremos llegar otras más y pues muchísimas gracias. Continuamos con nuestro programa. Que tenga muy buen día.
Perfect.